mode? Hang on.
Sure. Yeah, thanks, Shelley. Okay, so welcome everyone to the first PALS of the 2022-23 academic year. I'm very excited to introduce our speaker. Craig Ivany is, I think, the perfect person to talk to us about some of the CanMeds related topics, specifically health advocacy, collaborator, and many other in leadership as well. Now, for those of you that don't know Craig, he actually originally, I think, comes from the Newfoundland end of the country, where he actually did a Bachelor of Commerce, and I think he worked pretty extensively in Newfoundland in hospital administration, and he became eventually Executive Director of Canadian Blood Services operational portfolio. And then I think at a certain point, he also then pivoted to the Ottawa region, and he led the Eastern Ontario Regional Lab Association through its formative stages as Chief Executive Officer. And then he also spent some time in Alberta and became their inaugural President and Chief Executive Officer of Alberta Public Laboratories. And in 2020, we were fortunate enough to recruit him to come to PHSA or PLMS. And he's taken over as the Chief Provincial Diagnostics Officer, and he's been here now. And he had the opportunity / misfortune of taking over leadership just before the pandemic hit. And both Craig and Blake have done an excellent job navigating the pandemic from the laboratory leadership standpoint. And I've asked Craig to speak to us, not only to talk to us about his vision for the lab services in BC, but also for hopefully to kind of just help spark some of the residents in terms of getting interest in getting involved in laboratory leadership. Because one thing that's really struck me about Craig is he's very collaborative in nature, and I really think that that's a great thing that he has fostered, and hopefully will continue that way. So welcome, Craig, and I'll let you take it away.
Thanks very much, Tyler, and it's a pleasure being here this afternoon. I'll just share my screen and we'll jump right in. How's that sound?
Sounds great.
Does this look good, Shelley? Okay, good. So thanks very much for inviting me to speak today, Tyler. It's always a pleasure to spend some time talking about my favorite topic. Which is laboratory service delivery, and I've got I put some thoughts together today for our presentation to help think about the context within which we find ourselves here in British Columbia, and things we should be thinking about, and just some structural ideas around where we're trying to take PLMS, Provincial Lab Medicine Services. So I'll start by I'll start by advancing my slides if they're going to advance. Goodness. Just give me 1 second here, because it was working before we started. So before we get going, as always, and we're about a week away from the National Day of Truth and Reconciliation, I want to acknowledge that we're gathered in many different places, and in those many different places, many of us are on unceded traditional and ancestral territories of First Nations. I personally today am joining from the unceded traditional and ancestral territories of the Anishinaabe Algonquin First Nation. Really interesting where I am today. It has been a meeting place for over 8 millennia for many First Nations. It's actually Ottawa, and it's today continues in that vein as a meeting place for Canadians. I'm very grateful for their stewardship of these lands, and I take the time to reflect on my appreciation for the challenges that our First Nations experienced in their experiences with Canada over the many years, and look to be as strong an ally as I can for cultural safety as we move forward. So with that, I'd like to move forward with the presentation. We've identified some learning objectives, loosely speaking, identify and explore the nature of the lab services delivery sector in British Columbia, identify and explore some of the contextual tensions that lab leaders may face, and potentially some implications and opportunities for the future of lab services in British Columbia. Just in reality, I guess in some ways, just a way for us to think about it as we advance lab medicine. So I always like to start with kind of a slide that says laboratories are vital to the health system and society. We learned that through the pandemic. Not only is it a health value to the health system, what we learned in COVID was we provide a strong value to society. We do that, and yet as a cost or a budget to the health system, sit at about 3 to 5%, depending on the jurisdiction you're in Canada. Another interesting thing is that just looking at where CADTH has been looking to the future trends that are shaping healthcare in Canada. This report came out in March of this year. They identified 10 trends to watch. 5 of those, interestingly, 5 of those have strong lab medicine opportunities or strong lab medicine interdependencies. And I think if you looked at a couple of the others, you probably could see linkages as well. What this speaks to is the critical value that lab medicine and its delivery has in shaping healthcare in Canada. And I think that's a strong message that I want people to, if there's one message that people take from my observations, that's probably it, that lab medicine is an important aspect of health service delivery in this country. And we have to take a strong leadership role in ensuring that our value and our voice is heard. There was an interesting report that was generated in 2017 as Alberta moved through a reflection of its lab system, and a very robust report was generated. Dr. Penny Ballum produced it. Some of you may know her. She is the chair of Vancouver Coastal Health Authority. Couple of key lines out of her introduction. She speaks to lab as a unique element of the health system. And I think that is a very strong and important message. And also she went on to say that lab services are one of the most critical and sometimes most underappreciated areas of our health system. And that's a piece that a bit of a theme for me as well. I think those are important words coming from someone who's spent a deep amount of time in our environment. But when we think about lab, we first need to step back and look at the health system. We know it's under pressure. We know that there's constant discussions around funding pressures. We've always heard about growing and aging populations, growth in chronic disease states. But what's really interesting are a few things that have really percolated to the top of the list recently. Health human resources under significant strain, and we're starting to see shortages of key professionals. This is an emerging pressure and risk for the health system. And also when you go down that list as well, the empowerment of citizens and patients, that's coupled with this digitally enabled world that's challenging service delivery norms and expectations. So I think those 3 things have changed some of the pressures that the healthcare system has experienced. Some of the other ones have in many ways always been there, but we are seeing some substantive changes. And as a result of those changes, we're also seeing disruption in the care delivery environment. So we're seeing changing clinical decision-making models. We're seeing the integration of lab testing within care pathways, which then requires lab leaders and laboratorians to involve and get more involved in with more stakeholders and multidisciplinary teams as healthcare services start to reorganize. And even the total lab testing process is changing because it's moving towards direct towards the citizen. In fact, the citizen, the residents of BC could automatically go and get a COVID test during COVID without a requisition. And so some of those discoveries and some of those processes were not lost on health policy makers and not lost on those who are attempting to advance health services. These are disruptions that are happening at this point in time as we go forward. And that's going to drive new clinical governance and new financing models as we go forward. So a lot going on in the health system. When we think about those circumstances against the backdrop of lab medicine, we are experiencing disruptive change. Again, there's no shortage of pressures on the lab side, but not only are there lab service pressures, but also there's changing clinical laboratory clinical pressures. And we're hearing that and speaking with many of the practitioners that the goals of pathologic analysis is changing, the analytic tools and knowledge is changing, the context is changing, and the specialization of knowledge is changing. So we have a disruptive and we have a changing environment. And the question I really come back to is, how do we ensure that lab sustains its place of critical importance in the system as we go forward? So with that in mind, picking up on Penny Ballam's theme, I believe lab services are complex enterprises. And I've just described here the value stream along with the multitude of other critical elements necessary for lab leaders to be reflecting on, thinking about, and working in beyond the pure lab value chain, operations science, facilities planning, IMITs, medical affairs, human resources, supply chain, planning, governance, medical compensation, procurement. These are very, very complex issues that I don't know that they find the same level of relevance in other medical or other program jurisdictions when it comes to pure practicing of a medical specialty. But in lab services, I believe what we find is that you will all be part of very complex enterprise environments. And not only that, think about the complexity within the lab setting. Each of these specialties that I've identified have different value chains associated with them. A biochemistry value chain is going to be vastly different than one for transfusion medicine, for example, or surgical pathology. And then depending on where that lab enterprise sits, they're going to have unique political dynamics or geographic dimensions. They're going to have unique governance structures. Funding models may be different, medical staffing structures different. So very much a complex environment that we all get involved with. And so I say all that, and yet a lot of people who are outside of lab medicine reflect on lab, and I'm a layperson, so I get to say this. They see lab as a three-letter word, LAB. That's it. It's a line item on a budget. It's a side of desk issue for many. And even when we talk about a lab medicine, I looked on one of the one lab profession's website, and they talk about personnel management and administrative structures and policies and procedures. But that conventional view of lab services as being lab, or lab medicine as being something that's wrapped in a service, does not do us justice as far as I'm concerned. And when I think about lab services as a complex enterprise, I think of all of these areas where we have to have collectively insight and understanding and capability to enable lab to maneuver this world that we're in, and to position lab services to be successful in a complex multi-provider environment in this province. So I've just highlighted some, I think, of the complex ways that we should see and think about lab services, and why it's so important that all of these elements need to be taken into consideration. So just stepping away from that broader context, let's delve into a little bit of an overview for British Columbia. So if we go back a couple of decades, there was a Lillian Baines and Associates report in 2003. And her report identified the goal of lab service reform to create a patient-centered lab service system that is accountable for high quality, affordable, and accessible services to British Columbians, which will be sustainable into the future. And really what she was talking about was a system, not a multitude of systems, but a lab system. And so she identified reform initiatives in a number of areas, legislation, governance, funding, multiple funding mechanisms, stakeholder acceptance and adoption, and lack of integration of public and private sector delivery. Some of these things have been identified for 20 years. Many of these things are still relevant today and are becoming even more complex as the backdrop within the health system is changing as well. And here's a little bit of a snapshot of that history that the journey that it's been on from 2003 to 2014. Lab Services received moving from her review through a series of review panels, consulting reports, and committee reports, all in a way to generate something called the Lab Services Act, which received royal assent in February 2014. And so that legislative framework, prior to October 1st, 2015, when it was, I guess, brought into act, when the regulations were kicked off, lab services were insured under two pieces of legislation. And those two pieces of legislation were replaced by these acts for the purposes of administration and delivery of lab services. And under this, the Minister of Health is responsible for the governance of and accountability, audit, provision of benefits and compensation for all lab services in the province. But remarkably at that point, nothing changed in terms of how funding flowed to the healthcare system. Nothing changed in terms of the global budget funding model for inpatients. Nothing changed for the fee-for-service model at that point for community-based lab testing, and nothing changed with respect to out of province, out of country funding and how it should be governed. It was put in place with an intent to move forward with transformation, leveraging those capabilities over time. And so from 2015 to 2022, we've gone through some evolutions coming on the heels of that act. We've gone through the establishment of something called the Agency for Pathology and Lab Medicine. It was originally delegated by the minister to administer the elements of the Lab Services Act. There were a number of ministry functions that were reassigned. The Provincial Blood Coordinating Office moved under the agency. An Alliance Management Office was established to work with the private sector labs partners. And governance, funding, and service delivery strategies were evolved and developed. There was a tremendous amount of work by the agency to look at not only system-wide strategies, but also discipline-specific strategies and requirements. A lot of great work. And then in 2018-19, the decision was made by, I'm presuming, changing government, changing priorities, to assign accountability for the agency to PHSA. And PHSA blended the agency with the Lower Mainland labs to create this thing called Provincial Lab Medicine Services. It's important to note the notion of governance and funding mandate was not advanced at that time. So that sets up for this curious journey that we're on. And in many ways, the funding models have not changed from that point forward, save and except for what happened in 2020 with Life Labs, the Ministry of Health, and PHSA. They entered into a long-term master service level agreement, and I'll say a little bit more about that later. That's been the one substantive change in funding and governance and roles and responsibilities, I think, that has really transpired since the establishment of the Act. And in 2020 as well, PLMS was assigned the coordinative function for the lab system response to COVID-19. So those were two big things that have happened since that transfer to PHSA at that time. And in 2022, where we are today and what we're talking about and what I'll share with you today a little bit more is some of the stuff that we're doing to try and leverage the pandemic investments and the learnings to create provincial collaboration towards a provincial laboratory operating model. Bearing in mind, we're doing all of this because the times and the changes in the health system and strategies of the ministry are demanding it of us. So the Life Labs Innovative Partnership Model in 2020, it was a financial model with net benefits for the province, shared risk and transparent costing for a value chain of services. It established a long-term relationship with Life Labs. Interestingly, it moved Life Labs away from fee-for-service payments towards a value-based services with fixed payments. It ensures a sustainable mix of private and public, which was important to the ministry at the time and the policies. And it also creates opportunities for innovation, leveraging Life Labs' expertise and infrastructure where appropriate. And it also includes performance monitoring elements. So a real big shift here. One where Life Labs was an entity in the health system and was operating on a fee-for-service model, to one where the fee-for-service was set aside, and they rapidly, by virtue of COVID, became a critical partner in the province's response to COVID. And so through that journey, we looked at the partnership. We looked at the master service level agreement to understand how the system needs to collaborate, regardless of the nature of of your role in that health system. And so the ministry has here's the broadest perspective of our provincial labs system. So we've got inpatient services, we've got outpatient services, and this is just to contextualize for you that it is a substantial spend. I mean, in terms of 2021 dollars, it looks to be about I want to say $940 million to spend. We're $1 billion piece of the healthcare system, and so it is complex, and we have a number of different dimensions by virtue of the multi-provider environment that we exist in. So just to put it in perspective, here are the key lab organizations in British Columbia. I just tried to put them in one bundle to try and help understand it. And in many ways, certainly all those in the lighter blue have to connect as the health system evolves towards the citizen, towards a digital health system, towards virtual care, towards care anywhere with new technologies. So you can only imagine the kind of relationships that are necessary for all of these pieces to really work well together. And then to give context to the lab leadership, my goodness, it is a lot of work and effort to ensure that we achieve alignment across all of the various labs in this province. And that's a critical role that PLMS sees playing in the future. But just to give you context, that's a tremendous number of different leaderships with different enterprises, with different end state objectives. And how do you coalesce those around those greater provincial dynamics that we are facing as we go forward? So all of that, I think, brings some areas of risk for the BC Lab Services area. In many ways, we can use the word, it's a fragmented provincial lab system. The legislation has changed, the funding hasn't, governance complexities depending on where you are in the system, different management approaches, different priorities, and different delivery systems. We've got lab workforce sustainability risks, no question about it, particularly as things like growing populations and growing demands against anticipated growth in cancer, for example. We've got information system complexity up the yazoo, to coin the phrase. There is tremendous amounts of complexity around it. And the challenge we have in this area is the challenge to coalesce, not just the lab folk in discussion and coordination, but every one of those organizations, IMIT's leadership teams, to get on the same page. By virtue of the fact that we are a small component in terms of impact through the lens of a CIO, it's very difficult to get in front of them and to convince them that this is the #1 priority, to connect the lab system electronically. We also have challenges associated with investment strategies. They are enterprise focused. They have to be. Our lab leaders have to focus on meeting the needs of their organization in a means and a fashion that works for their enterprise. There's limited, by virtue of that, there's limited provincial coordination, and there's at times uneven technology deployment. So in all of that context, we've got this mandate that PLMS has been given to work collaboratively with the ministry, the regional health authorities, and I would argue this is their line, but I would argue as well, and all stakeholders, to implement a cross-sectoral provincial plan, service coordination, keywords, right? Coordination. In other words, from my perspective, to engage and enable in support of an integrated and interconnected lab system, to connect and coordinate to drive clinical lab strategy and innovation, and to enable lab to be a strategic system partner to solve problems, provide solutions to support our health system evolution. So just at a high level, I just want to show you a few of the successes that took place from the lab system's COVID response. I believe it was focused, I believe it was coordinated, and it was successful. And I think we can draw a lot from that experience to talk about how we can work closer together going forward, whether it's in just service planning and delivery, whether it's improving digital lab information exchange, policies, guidelines, working on provincial level budget accountabilities, working on health human resource pressures. Regardless of what it is, there's a tremendous amount of opportunity coming out of our experience with COVID for PLMS to really play a critical role going forward. And so with that, I'll shift gears and talk about the emerging role of PLMS and some of the things that we're doing on those three different levels of strategy. So based on COVID, we looked at this, the purpose of PLMS, and we tried to imagine it in the context of being a connector. So we saw the importance of engagement and enabling. We see the core central focus of as being clinical strategy and innovation. And of course, we always want to advance lab medicine as a key player in the health system. So those are the three areas, themes that we embraced. With respect to the engagement and enablement, we are driving provincial coordination through something called a provincial lab, lab leadership forum. We bring all of the lab leaders, the medical leaders you saw on that slide earlier, along with their operational dyad partners, many other stakeholders to the table to talk about common issues and to help focus, to help provide guidance, and to help provide advice in terms of how we advance provincial lab strategy. We also are reinvigorating and advancing the provincial discipline committees that were established under the agency. We are adding operational leadership and technical leadership to that table. We're also bringing in some key stakeholders to some of those tables as well. The relationship management with private sector partners is important so that as we face challenges in the system, we are able to ensure that all of the component parts, all of the providers are at the table. We're in the process of updating and reflecting on a new test review process. And we're also been given the opportunity to strengthen provincial lab analytics and stewardship. And some of these things are just now starting to emerge. And they're all, as I said, learnings from COVID. So this is a target operating model where PLMS sits. The fact that we see ourselves within that network, including the provincial lab system, the Department of Pathology and Lab Medicine, system stakeholders, many other working groups, and we provide. We're going to use that format to provide advice and guidance to the Ministry of Health, ADM, and the PHSA EVP for Business Operations, who jointly are accountable for something called a Lab Advisory Committee. I'll touch on that a little bit later, but essentially that committee is a bridge between lab strategy and innovation and the leadership council that's guided by the deputy minister. The intent is for PLMS to draw on all of the insight and advice from all of our stakeholders and all of our partners to provide good insight and advice to this lab advisory committee, which is made up of senior executive leaders assigned by CEOs of health organizations to sit on this committee and to provide their guidance and feedback on lab strategy and innovation, and to help us then advance provincial system strategy. So in terms of PLMS clinical strategy and innovation, our initial work is to leverage some of the enablers that we're building. We're attempting to align with ministry priorities, and also we reached out this spring and we worked with our lab leadership community to do regional interviews and get feedback. And from there, we're starting to explore opportunities and launch assessments of where we can advance the lab agenda, where it makes sense in terms of provincial coordination. From a clinical strategy and innovation, we also support lab partner initiatives. So whether that's a total lab system review in Northern Health, or whether that's a community lab system response in the interior, or other discussions associated with forensic toxicology, for example, we are there to support partner initiatives. And we also want to partner with the system to secure commitment and investment. So here, the Ministry of Health asked us to start looking at some of the areas where we can identify opportunities to advance provincial strategies. And we identified 4. We started looking at anatomic pathology technical services, PLMS, the PLIS data, provincial middleware solution, and e-order health authority business requirements to enable lab electronic order systems. So these were 4 that we did some assessment work on, and that we brought forward to the lab advisory committee for more guidance. And it's really interesting as well that those 4 do fit with the priorities or the relative importance that our regional teams, our medical and operational leaders identified across the province. And you can see there that automation, digital, IT were 3 things that were, or NHR were 4 things that were identified by everyone as being super important and super critical. We also recognize that some of the things like next generation sequencing, translational medicine may not be relative to some of our stakeholders, nonetheless are important. And so we actually also validated some of those, ideas for innovation against what we're seeing and hearing in other jurisdictions. And what it appears is that things are lining up nicely for us in terms of how we choose to advance some of these tremendous opportunities as we go forward. And one of those was this case for digital pathology. As I shared earlier, we did some work in anatomic pathology technical services, and an outpouring from that, and as well as the feedback we got from our broader community, was let's explore the value of digital pathology as an overarching opportunity to coordinate and integrate across the system. And so Dr. Jilks and Lise Matsky led a team that connected with all of their partners across the province who were involved in anatomic pathology. And we're doing this in the backdrop of work that we understand that's taking place at BC Cancer, associated with the rise in cancer demands on lab services. What is interesting is BC Cancer is focused on the post-diagnostic patient journey and patient care requirements. And in discussions with them, we saw an opportunity or a gap that we felt was important to be addressed, and that is the impact of rising cancer demand on lab services, which comes back to why we need to have investments like digital pathology in the future. You know, from our perspective, we're still in the process of validating this capacity gap, but we recognize that there are a number of investment strategies that are necessary to advance that. And so our team did the work and connected health authority wide, found that there's health authority wide interest in a provincial digital pathology initiative. We identified a series of benefits, and we brought that forward to the lab advisory committee with the intent of putting this squarely on the agenda for strategic investment by the province. And so it's a journey for us, because it's one of the first times that we get to explore this. But the important thing is we're trying to set the stage where the lab strategy for some of these province-wide initiatives is coordinated, is connected, and is seen as a system, an important system investment. We also focus on strategic partnerships. And so, as I said, the Lab Advisory Committee is one of those critical partnerships that we've had good fortune of setting up. It's Joint Ministry of Health and PHSA initiative. And we've also been building strong health system relationships, whether that's with BC CDC, Children's and Women's and BC Cancer within PHSA, or whether it's with the health authorities. We also have an emerging relationship with the digital health community, which spans beyond the health authorities. It spans beyond the private lab sector. It's part of the overall ministry digital health strategy. So we are embedded in those discussions, engaged in those discussions. And finally, what I'm really pleased about is the engagement that we're making with the department. That's probably one of the reasons why Tyler's invited me here today. We see this as a critical partnership as well. And so a number of strategic partnership activities are in flight against a number of different backdrops, whether it's supporting demonstration projects in digital health strategies, or advancing newborn screening capabilities, supporting genomics and precision medicine competencies. All of these things are in flight as we speak. We're trying, some of them are in assessment stage, some of them we're actually active in addressing as we speak. But it's the kind of things where PLMS can play a role, be a connector, bring the right parties to the table in a safe environment to have the appropriate kinds of discussions. And from my perspective as well, I think about this forum today. I think about my relationship with Dr. Gao and the department. Really believe that PLMS and the Department of Pathology and Lab Medicine, we can strategically collaborate to contribute to the transformation of the BC healthcare system. I don't see it as transforming the lab system. I see it as contributing to the healthcare system. And so I'll just wrap up, and then perhaps we have some time for questions. But look, I said it at the start of the show. I'll say it again. Lab is strategically aligned to health system strategy. It's vital in sustaining patient care and enabling the health system with timely delivery. It's essential to optimal patient outcomes and a high-functioning, high-quality healthcare system. And investment in lab medicine supports value-based healthcare strategies. I think these are important messages that we want to ensure that others hear. And so what I would say is that the job that PLMS, or the opportunity for PLMS, and the thing that we need to think about, whether you are just entering professional practice or whether you're part of the system today, it's really about how do we advance on a collaborative basis how do we advance innovation in our multi-provider lab service delivery system against that backdrop of where the health systems are changing rapidly and the dynamics around them are changing rapidly. And I think the risk is that if we don't collaborate, we will fail to capitalize on the amazing response and the learnings that we took from the COVID response. And we will fail to advance the critical value of lab medicine in this system. And I think we're poised to make a difference. and I think we've taken a lot from the pandemic to create that sense that we can bring more to the table as a partner. So I'll stop there, Tyler, and turn it back to you.
Great, thanks, Craig. Really nice overview, and I think there's a lot of good themes that you touched on. I think the collaboration, the involvement of all the various stakeholders, and I think also more than anything, how hard it is to change a system. Even if those changes make sense in the long run, it's just hard to make that. Yeah, but I think you guys have the right approach, and I think that your kind of approach of engagement, collaboration, and just kind of trying to get everybody rowing in the same direction is a good one. And I also really appreciate your advocacy for lab, because as all of us know, and as you touched on in your talk, lab often gets maybe not enough attention, and also I think probably the personality types that are in lab tend to be a little bit more introverted, analytical people who are maybe not quite as good at self-promotion kind of thing. But yeah, thanks a lot, Craig. Any questions from our audience? I don't see anything in the chat, but feel free to put in. Oh, Stephen, yep, has a question, and feel free to enter in the chat function too. Stephen?
Thanks. Hi, Craig. So I think you described a lot of, you described the vision of the PLMS in terms of developing a cohesive pathology lab testing strategy. Is there any way to enforce this vision? For example, like a lot of labs want to do molecular NGS testing, and how do we sort of enforce this in maybe a carrot and a stick approach? Do you have any way to do it?
Yeah, that's a great question, because I think you recall the slide that went back a ways that talked about funding and governance did not change when PLMS was structured up. How do we do it? Well, what's interesting is that the Ministry of Health more and more is looking at strategic investment, and more is looking at strategic innovation. And what PLMS can do in partnership with all of the providers is bring forward rational strategies that reach and touch the entirety of the province in terms of service and in terms of delivery, and bring those forward in a coherent fashion that just makes strong arguments. And I think if we, the opportunity or the challenge is for us to come together on those strategies, agree on those strategies, leverage the partnership environments that we have to provide the right advice and guidance to important organizations like the Lab Advisory Committee and Leadership Council. If we're unable to demonstrate, our ability to link together and collaborate, it will become a challenge. In one Lab Advisory Committee meeting, I was reminded by one senior executive vice president. His words were, please don't come here unless you, with a proposal, unless you can assure me that you have the full systems agreement to participate and be a partner in this, because he was saying he would prefer not to have fragmented solutions going forward. And I think we're approaching a point, Stephen, where we won't be able to afford those standalone solutions, and as we make these individual investments, could risk more fragmentation if we're not coordinated. I hope that helps, Stephen.
Yeah, thanks.
Okay, Craig, I see there's a question in the chat function and a question from Andrew. So maybe I'll let Andrew speak, and then I can ask the question in the chat.
Sure.
Hi, Craig. Thanks for that excellent talk. And I totally agree with you. I think there's so much potential for PLMS to be the connective tissue of the province that helps coordinate and helps us advocate for each other. I was wondering whether or not you see there's value in having more formal partnerships with clinical programs. So I guess where I wanted to lead into that is that what I observed that oftentimes lab and clinical engage in times of crisis when it comes to service delivery. And I think immediately that sets up the conversations and the dynamics to be very adversarial, which is not productive. And I think where we have shared interests, especially around appropriate utilization and appropriate utilization, having a partner in that respect is extremely helpful as well. So, you know, wearing my PBCO hat, I think of two examples. One is that, you know, when we talk about immune globulin, having a transfusion medicine physician say to a neurologist, no, I don't think this is appropriate, I think is a very different conversation than when a world-renowned expert in neurology has that conversation. And then I think about our hemophilia program and just the fact that we've had partnerships that way. Factor product is used more appropriately and testing is used more appropriately. And you also have better outreach into more rural and remote areas. So I was wondering, you know, a lot of these relationships will happen naturally based off of the individuals within them. But I wonder if there's some ability for PLMS to connect on a slightly more formal level to organizations for clinical programs like BC Transplant, BC Renal, you know, and so forth.
Yeah. So Andrew, thank you for the question. And I would say that PLMS has a lot to learn from PBCO. It's been around for more than 20 years. It's done some remarkable things on a provincial scale for transfusion medicine, and emulating that is important. And what we're trying to do in our discipline committees is at the core, they are focused on lab, but we also want to make room for clinical input, clinical partnership, clinical insight. And so our philosophy is to provide that bridge back to those critical programs, just as PBCO has done. In many ways, trying to emulate that. We're trying to emulate it in terms of our genomics and genetics discipline committee, listening to the oncology group, the constitutional genomics groups, the clinicians who use it, to provide that advice in. It's crawl, walk, run for me in that journey, but you're absolutely right. We can't be a silo. That's part of this partnership conversation that we have to think about. And of course, I think about it from a health services perspective. You see it more clearly and more importantly in that clinician to clinician, practice to practice environment, which is vital as well. Couldn't agree more.
Thanks, Craig.
Great. I see Vilta has a question, but maybe before that, I'll just quickly read out Michelle Wong's chat question, which was respect to the AP Digital Pathology Initiative. Has there been consultation and consideration of hematopathology similar to AP? Digital pathology is an important tool in HP and may be helpful.
It's a great question. So I know that the work that was done by Blake and Lees was focused on the anatomic pathology. But when it comes to hematopathology, Dr. Hudova, who's just literally stepping away from the role as the discipline lead for us. By the way, we've got a posting out there, I believe. But she highlighted that discipline committee highlighted for us the importance of provincial middleware. And that was one of the areas that we investigated as part of the assessments to determine, you know, how to leverage connectivity in the hematopathology space through that journey. But I certainly will have no problem bringing back to ask the question, the digital journey is not siloed around pathology. It was identified for the anatomical pathology, but for sure we had some conversations with Dr. Hudova. We actually, because of that, sprang into doing assessments of the middlewares and the linkages necessary from that realm. But if we missed something there, we'll certainly take that back and look at it.
Yeah, thanks, Craig, so much. I really enjoyed your talk. Yeah, like that working group and speaking about the middleware, that is probably something slightly different that had to do with the hub and spoke model. Yeah, we just wanted to highlight that perhaps, you know, even as the work in AP is happening, just some consideration could be given to HP at the same time so that, you know, sometimes it's helpful not to duplicate work later or just to do it all up front. And yeah, sometimes there could be savings if, you know that two divisions, you know, the needs are similar.
100%. Thank you for raising it. Actually, after this, I'll double back with the team and just say, you know, like, let's take a look and make sure that we capture that feedback and insight as well. You're absolutely right. Appreciate it, Michelle.
Yeah, thanks, Michelle. Vilta?
Hi, thanks so much. Really great presentation. Really nice to see a lot of the integrated diagrams and how the agency is going, or how PLMS is going to leverage some of the gains that have been made during COVID. I did have a question regarding how PLMS is collaborating with stakeholders who impact laboratory expertise and workforce in BC. I really liked your diagram that showed all the different kind of organizations and entities that are working together to achieve both PLMS's role and lab medicine kind of visions in the province. I saw UBC's pathology department on there, but didn't see BCIT or CSMLS, nor any sort of mention of the clinical scientists such as our CCMG, CACB, and clinical microbiologists who also contribute to lab services. And you know, like we've known about the potential crunch for the workforce in lab for at least 10 years, probably longer. And so, you know, hopefully there's a role for PLMS in supporting and advocating for ensuring that we are supporting training and of the right skills and people who can work with new technologies and support high quality lab services from the multitude of aspects like of the workforce that we have.
Yeah, thank you. Absolutely, 100%. Actually, some of our team are now on the board of BCSLS from an operations perspective. We've reached out to BCIT. We'll likely there's room in the boat for everybody. You know, we don't. Our Lab Leadership Forum is focused on some health human resource issues today. There's some sub-working groups. Just recently, there was a flag raised associated with pathology assistants. We know that there's some other key professions that have pressure points as well. So we are certainly recognizing that for lab medicine and pathology to function in this province, it takes a community. And I didn't want to suggest by virtue of highlighting UBC that the multitude of stakeholders is enormous for us, but you're absolutely right. And I appreciate you raising it. And in fact, would welcome an email just from you afterwards, if you wouldn't mind, for me to reflect on this and to engage my team to ensure that we are building or have the right kinds of relationships going forward. So if you wouldn't mind, I'd appreciate that.
Great. I see another comment in the chat function from Christine Collier. And I think similar to, I think maybe what Andrew was talking about, she was wondering on a different angle, is vision or utility in evaluating appropriate utilization? Just looking at, could there be access to some of the funds saved and work on moving laboratory medicine and testing forward with the saved money? So I guess the idea is, you know, encourage utilization to save money, but then allow that to facilitate more innovation.
Yeah, music to my ears. Look, the challenge we have associated with the funding models in this province, there's realities about how a provincial health system is structured. There are a series of silos and how funding moves around. We're actively trying to ensure that that kind of thought process can occur. But more importantly, we know that there is limited new funds to the health system, and in many ways it's a zero-sum game, that if we are to fund some things, those funds need to come from somewhere else. And certainly when we look at stewardship and utilization, the opportunity for us is to be masters of our own fate in some respects, to drive better lab utilization and to have agreement with our partners in the system that, look, if we make room, those dollars get reinvested in some of the new emerging tests required to stay current and just to provide the standard of care. We are starting some work because we've been able over the last year and a half to build out analytics capability. We have a requirement under PLMS to work with the ministry, and the Ministry of Health is looking for us to start investigating utilization. I like more term stewardship, and my view on it is that, you know, that's the direction we need to go, is to look at lab ordering, lab utilization, and to be able to create the room for new investment through that smart work. So as I said, music to my ears, and that's something that I think is important for us. Some other jurisdictions in Canada have more flexibility in moving funds around. We don't have that in this setting. We have to live with those realities, but we're working with a bunch of folks to try and figure out how to make sure that can happen.
Sounds great, Craig. Sasha, do you have a question?
Thanks. You could see I put my video on. I forgot to put the hand up. Hi, Craig. So I can't let the comment about enforcement go, as you might imagine, because I thought the tone was a little odd. One of the reasons why lots of people in different health authorities are trying to do the same thing is because all of their patients need access, and the 1 or 2 laboratories in the Lower Mainland can't provide it for the entire province. And I think a good example of that would be COVID testing, where if we hadn't had a molecular lab within our medical microbiology department and had to rely on the CDC, essentially civil society would have collapsed on the island over the last 2 years. So I guess just my comment more than a question is, or an answer to the question is, the way that you enforce centralization outside of extraordinary circumstances would be that you don't, unless you want to see all of the outlying health authorities break away and do their own thing for the sake of their patients and at the expense of PLMS.
Yeah. So Sasha, I think I hope I didn't intimate in my discussions that centralization was a thing. It's really about looking at how we deliver care. And to your point, we were successful with a distributed model in terms of COVID. And as we know, as technology and demands and access issues emerge, we have to be smarter about delivering that across multiple different environments, right? So I think we're aligned on that point, Sasha, 100%. The challenge will be as we look at some of these super esoterics, if we're able to bring them into the province as a starting point at least. But as we all know, the importance of and the changes in terms of technology is allowing us to think about some of these things differently. So I think we're all aligned from that perspective.
I agree. Thank you.
Thank you for raising it.
Graham?
Yeah, thanks a lot. Hi, Craig. I was wondering if you could speak a bit to the role of, or if you see a role of PLMS in the provision of lab services to support research studies. It's an area that's under pressure for a lot of us, trying to figure out how to help with the innovation system wide, yet still provide the clinical services. And I wonder if there's a look at investing in that.
Yeah, Graham, thank you for the question. Great question. It's interesting because in a lot of research settings or where researchers outside the lab look at lab, they actually look at it as an expense item on their research program or in clinical trial seasons as trying to keep that cost as low as possible, as opposed to bringing into the fold as a partner and to enable us to set up the right kinds of relationships and tools and capabilities to be able to support this type of work as well. So I'm not that deeply ingrained in how it functions here in this province to this point, but I know in other jurisdictions they found paths to ensure that the lab was supportive of those initiatives and was also structured to allow it to happen, either through the engagement with the researchers or the clinical trials groups, and as opposed to a lot of times what I've heard is some researchers just simply look for the lowest price is the law kind of thing with the testing that they need, and that's not valuing lab from a broader perspective. So I think there's a lot we can do there, and I think there's a lot of pressures on labs. The expectation on lab is just to simply absorb it. That isn't effective in terms of looking at lab as a partner.
Great, thanks a lot.
Was that what you're does that help, Graham?
Yeah, I think, we're doing a review here
Yeah.
at Children's and Women's and been doing an environmental scan across the country and across different hospitals in BC and trying to get a sense of how others manage this, because it's such a challenge to meet the needs of growing, clinical trials load with the staffing that we have. So I think there's some opportunities for coordination and
There is.
collaboration.
You may want to talk to your friends in Ottawa.
I have. Yeah, thank you.
Great. Well, I think we've hit the end of our time, but Craig, I want to thank you for this great talk. And I think your engagement approach is certainly recognized here. We, I think, set a record for PAL's audience. I think I saw 140 attendees at one point. But thanks for your time and the great talk, and I look forward to collaborating in the future, and hope people have a better understanding of where we're going forward here.
Thank you, Tyler, for the opportunity, and thank you everybody for the tremendous feedback that in the questions after the presentation. I genuinely appreciate the opportunity to connect.
Great. Thanks, Craig, and thanks everyone for tuning in.
Bye for now.
Bye.